Okay, here we have a NIH, National Library of Medicine, National Centre for Biotechnology and Information, pubmed.gov, and this is official United States National Library of Medicine, and they are reporting on August 31st, 2022, and it was published, and it's concerning serious adverse events of special interest following mRNA COVID-19 certificate of vaccine identification 19 vaccination in randomized trials in adults. Now here we have the results of those trials, but just to have the discussion, the excess risk of serious adverse events found in our study points to the need for formal harm-benefit analysis, particularly those that are stratified according to risk of serious COVID-19 outcomes. These analyses will require public release of participant-level data sets. But it seems to me, for some reason, all this information is being withheld, and this National Library of Medicine document clearly is asking or suggesting it should be in the public domain. And here we have this document concerning these trials. In 2020, prior to COVID-19 vaccine rollout, the Brighton collaboration created a priority list endorsed by World Health Organization of potential adverse events relevant to COVID-19 vaccines. We adapted the Brighton collaboration list to evaluate serious adverse events of special interest observed in mRNA COVID-19 vaccine trials. And it goes on about the methods. Now the results. Pfizer and Moderna mRNA COVID-19 vaccines were associated with an excess risk, listen to this, excess risk of serious adverse events of special interest of 10.1 and 15.1 per 10,000 vaccinated over placebo baselines of 17.6 and 42.2. And it gives you the figures there respectively. Combined with the mRNA vaccines were associated with an excess risk of serious adverse events of special interest of 12.5 per 10,000 vaccinated. Now it must be interjected there that in the past they brought out vaccinations, and with as little as a 1 in 100,000 serious event, adverse event, they stopped the rollout of the vaccine. But they carried on the rollout of the vaccine for these 12.5 or whatever it is for 10,000 vaccinated. But for 1 in 100,000, they stopped the others. So why did they not stop these? Clearly, the serious adverse effects far outweigh for these jabs than they did for the ones they stopped. I think it was swine flu, etc. They stopped them jabs due to that 1 in 100,000 serious adverse event. The Pfizer trial exhibited a 36% higher risk of serious adverse events. The Pfizer trial exhibited a 36% higher risk of serious adverse events in the vaccine group. Risk difference 18 per 10,000 vaccinated. And it goes on there, 95%, 1.2. Risk ratio 1.36. Figures there. The Moderna trial exhibited a 6% higher risk of serious adverse events in the vaccine group. Risk difference goes on for the risk. Combined, there was a 16% higher risk of serious adverse events in mRNA vaccine recipients. And it gives you the risk differences and ratios. And here we have on the screen now doctors and those in high up in their field questioning why the information regarding vaccine findings, etc., are not being put into the public domain. The public posting of raw data is a reasonable response. Open data is becoming the norm in science and is now required by many leading journalists. This information is essential to the understanding of the balance between vaccine benefits and harms. We are calling upon Pfizer, Moderna and the FDA to release all information needed for a comprehensive assessment of these products. Yet evidence is being withheld, which adds uncertainty to our conclusions and leaves lingering questions about the scientific foundation for certificates of vaccine identification 19 vaccine promotion. The time has come for the FDA and EMA to reopen their investigations and for Pfizer, Moderna and all vaccine manufacturers to provide the data that will allow scientists and physicians to address outstanding concerns. So clearly, it seems, there is data being withheld, which is not being put in the public domain, and also which is not being allowed to be discussed by those who should be discussing this data for the safety and efficacy of these certificates of vaccine identification still under trial and experimental jabs.